My name is Jason Schuster. I'm a doctor of physical therapy. I own Intricate Art Spine and Body Solutions. It's a continuing education company teaching other doctors how to do a couple things. One of those things includes GHK peptide therapy, among other peptides. Peptides are one of the biggest hidden gems in medicine. I just found a new 2025 University of Washington study looking at a combination of other studies on GHK, kind of summarizing why GHK is so important to improve health. It's a natural, safe molecule. It's great at improving hair loss, reducing risk of certain cancer like colon cancer, improving health. This study is specifically looking at GHK to improve longevity in mice and then trying to extrapolate that to humans. This is a great video. The full article is included in the description below. Check out our peptide therapy course. It's board certified and accredited. IntricateArtSeminars.com. Here's a 10-minute breakdown of what the researchers at the University of Washington found about GHK peptide therapy and how to improve health and longevity. GHK peptide therapy is blowing up right now. It's become super popular, you guys. And one of the reasons for that is it's safe, it's effective, and it works for a ton of things, including hair regrowth, health span, lifespan, longevity, improving tissue healing, all sorts of good stuff. GHK-Copper appears to be directly targeting brain pathways that are helping to reduce signs and symptoms of age-related disease. So GHK, like most other peptides that we've discovered that are super helpful in the human body, like BPC-157, thymosin beta-4, epithalin, MOTS-C, lots of other ones, they're much more highly concentrated when we're young. It's one of the reasons that we just heal from everything so much faster when we're young, is we have a high storage or a high concentration of these healing peptides that the body knows how to use. Remember, you guys, these are natural peptides. They have not been molecularly messed with. The pharmaceutical companies can't patent these things because they're natural molecules, which is one of the main reasons why nobody knows about them, is because it's impossible to make billions of dollars off of something that you can't patent, regardless of how much it helps people's health, which is crazy, you guys. But this is why I'm making these videos on peptide therapy, including GHK, because this is an amazingly potent way to improve your health span. This study is looking at improving lifespan and longevity. Regardless, it improves your health right now, which theoretically should improve your health in the future and make you live a little bit longer at the very least. So this study, you guys, is looking at a bunch of different things as far as what GHK does. So this study showed that GHK can alter 31% of human genes by 50% or more. And this is looking at positive enhancements to the genes, or just the effect on the genes. We know so little about how genes work, you guys, but the bottom line to think about it, I think the proper way to think about peptides and things like this in general, is that we can see that GHK alters 31% of human genes. We can also see that the objective, like visible, objective health outcomes of people that take GHK, the vast majority of people get a significant amount better, and the other people just have don't have any severe negative results. They just don't see the massive improvements. It works on a huge percentage of people. So we know that it changes genes. We know that people's health improves from taking GHK. So exactly like what the gene changes are doing and stuff, we want to know that stuff for sure, you guys. But the important thing for helping improve people's health right now is to be able to see, okay, is it safe? Yes. What is it doing in general? Because we can see in general stuff. We're just scratching the surface of science, you guys. We're just like little babies trying to figure out how DNA and all this stuff works. But we can see general concepts. So in general, okay, it's altering epigenetic factors. It's altering the way DNA is expressed. Same thing as what dry needling does and eating well does, you guys. And the overall outcome is improved health. So to me, that's good enough that everybody should be trying these peptides that has any type of mental or physical impairment, you guys, because they're safe and they're super effective. I help patients recover from things all the time with a combination of things like dry needling, manual therapy, nutrition, and implementing things like peptide therapy, and in some cases stem cells and other things like that. Natural substances, you guys. So this study looked at some papers looking at mice studies. Again, you guys, it's extremely hard to do studies on humans in the United States, even if the things are super, super safe, right? So on these mice studies, they showed significant improvements in hippocampal functioning. So mice were able to, they showed improvements in working memory, improvements in spatial learning. They looked at things about their astrocytes and their synapses and their immunochemistry, including RNA sequencing in the hippocampus and how the hippocampal or the brain DNA is expressing itself to produce certain amounts of certain proteins. So remember, you guys, one of the chronic signs of aging and one of the 12 hallmarks of aging is body-wide inflammation. I think an important thing to think about is, okay, people and doctors do this too. They think about, okay, there's inflammation. We test inflammation, at least right now, by looking at pro-inflammatory markers or pro-inflammatory proteins throughout the body. So some of the ones that are very, very commonly tested for across the board in medicine are things like interleukin-1, interleukin-6, tumor necrosis factor alpha, C-reactive protein. There's a bunch of other ones. And then there's also anti-inflammatory proteins, you guys, like interleukin-10 and a couple of the other ones. What people don't think about is, okay, if you're doing things that are causing your body to be inflamed, like 90% of the US is, per the CDC, 90% of the US is metabolically unhealthy, per the CDC, 80% of the US population is overweight, obese, or morbidly obese, per the CDC, 95% of people are vitamin D deficient. It's a disaster area, you guys, and GHK peptide therapy, among other peptides, are one of the things that can really, really help. So if GHK is positively affecting the brain, what it's doing as far as inflammation, you guys, is you have to think about it. If we have positive effects in the brain and we have a decrease in inflammation and positive effects in the skin and cancer cells and a bunch of other stuff, one of the things that GHK is doing is altering our DNA expression. So certain pieces of our DNA get translated into a piece of RNA, and that RNA gets translated into like interleukin-1. The only way interleukin-1 pro-inflammatory protein gets overproduced is if that section of our DNA is getting overexpressed. So what these peptides and dry needling and like things that make you healthy in general, like the base layer that we understand that they're working on, one of the things that they're doing is it's actually changing the way our DNA is being expressed, or it's changing what parts of our DNA are being expressed and how much they're being expressed, or if they're not going to be expressed at all. And that is one of the things, like epigenetic factors, that can change the way that our DNA is expressed, that can change our overall health dramatically. And that's one of the things that GHK peptide therapy does, you guys. And that's one of the things that's been shown in all these studies. And that's one of the things that they're looking at these studies. So they're looking at astrocyte regulation, the synapse regulation in the brain, neurotransmission, nerve conduction velocity alteration. GHK reduced a bunch of free radicals in the brain as well, you guys. So again, things that make free radicals, or the reason that free radicals get made, is some type of dysfunction in the molecular processing pathways. GHK helps modulate all that. So the overall takeaway, you guys, GHK is specifically shown in these studies to be really, really good at reducing brain inflammation. That reduces things like anxiety, depression, brain fog. If you have inflammation in your brain, it's like having a permanent concussion, you guys, which is how the vast majority of Americans are living. That's why these safe, natural treatments are so, so awesome. And it's frustrating for me to know about them and for not most people to know about them, but that's why I'm making these videos. So I want as many people to know about these safe, effective peptides as they can. And a great place to get these, you guys, the only place that I'm comfortable recommending that people go get peptides is Ways to Well in Austin, Texas. They have a bunch of locations now. You can do online visits with them. It's Ways, the number 2, well.com. You guys, they're a great company. I have no affiliation with them whatsoever. My employees use them. I use them. They have their own 503A U.S. pharmacies. They make their peptides in the U.S. I really like them. We've had great experiences with them. So that's the only place that I recommend that people get peptides from, and they'll provide you with one of their own doctors and do blood testing and all that other stuff. One of the other things that GHK has been shown to do specifically in the brain and everywhere else in the body is improve mitochondrial function and improve the concentration of reactive oxygen species or free radicals. So we need certain free radicals for certain things. It's just that when we have too many of them, it causes big problems for our mitochondria and for other things. So both sexes, males and female mice, showed and humans showed decreased reactive oxygen species secondary to GHK peptide therapy. They show reduced inflammation secondary to GHK peptide therapy. They show improved things like hair growth, improved things like tissue regeneration, things with colon cancer. GHK has been specifically shown to reduce the expression of colon cancer causing things. The mTOR pathway, you guys, lots of people have heard of the mTOR pathway. It's technically the mTORC pathway, mTORC, but this is one of the most heavily studied anti-aging pathways, you guys. So there's a couple of different mTORs, and if they're expressed or turned on/off in the correct orientation, they show significant benefits to health span and longevity of the cells, at least, which should correlate to improved health and longevity of us as humans. And then it also shows lots of positive effects on the p53 gene pathway. That one's talked a lot about in cancer, you guys, and a lot of other things. Overall, just like BPC-157, thymosin beta-4, GHK peptide therapy has widespread beneficial positive effects. It's a peptide that is more highly concentrated in our brain and in our body when we're young. And if you can amplify the amounts of it when we're older, it's like giving yourself youth juice or something like that, you guys. It's really, they have amazing effects. There's very, very little negative side effects from these peptides, you guys. There's like no serious negative adverse events per all of the research studies. Are extremely safe. What I tell my patients is, man, the way I think about these peptides is the best potential outcome is like awesome improvement to a problem that you got going on, or improved health, both mentally and physically. And the worst potential negative outcome is nothing happens at all. They're hugely effective. They're super safe. Peptide therapy should be a part of all mainstream medicine, you guys. It's really awesome. Check out my peptide therapy course at intricateartseminars.com, or to get a huge discount on all 5 of our nutrition courses, including our board certified and accredited peptide therapy course. Check out our school community, CEU Central. Check it out at school.com/CEU, SKOOL.com/CEU. Thanks, guys.